Hello everyone, I am Dr. Deepa. Today we are here to learn about a new topic, the extraocular muscles. The extraocular muscles are also called as the extrinsic muscles of the eyeball. In total, there are about 6 extraocular muscles. Out of the 6 extraocular muscles, we study the recti and the oblique muscles. So out of the 6 extraocular muscles which has to be studied, we have 4 recti and 2 oblique muscles. So there are 4 recti in total and 2 oblique muscles. So the muscles are named in according to the attachment. So the recti muscles, in total there are 4 recti muscles which include the superior rectus, the inferior rectus, the medial and the lateral rectus. So this is the right lateral view of the orbit, dissected orbit, showing visualizing the extraocular muscles along with the orbit here, along with the eyeball. As we can see here, the muscle inferior rectus, which is directed below the superior rectus, which is located in the upper part of the eyeball. Along the medial and the lateral wall lies the medial rectus and the lateral rectus along the lateral side. So the lateral rectus is been seen cut over in this view. So this is about the arrangement of the 4 recti muscles. Moving on to the attachments of these recti muscles. So we will study about the origin and the insertion of the 4 recti. The origin is common as all the 4 recti muscles take its origin from the common point, that is the common tendinous ring. So the origin of all the recti, the 4 recti are seen to arise from the posterior part of the orbit. So the origin is from the posterior part of the orbit. So when we talk about the entire orbital cavity, along the posterior part of the orbit lies the common tendinous ring, or also called as the common annular ring. So this ring gives attachment or origin to all the 4 recti muscle. So the origin of the recti muscle is from the common point, that is the common tendinous ring or the common annular ring, and the origin is in relation to the area over the common tendinous ring. Like when we talk about the common tendinous ring, which is seen to get attached onto the lesser wing of the sphenoid towards the apex of the orbit. Well, over this common tendinous ring, the attachment of the medial rectus is over the medial wall, the attachment of the lateral rectus is over the lateral wall of the common tendinous ring. The upper part of the ring gives attachment to the superior rectus, whereas the lower part gives attachment to the muscle inferior rectus. So this is about the attachment of the all recti over the common tendinous ring. The insertion, when we talk about the insertion of this recti muscle, of the 4 recti muscle, these recti muscles are seen to direct forward. They are directed straight forward within the orbit and spread out at the site of their insertion towards the sclera. So the insertion of all the 4 recti muscles are over the sclera in front of the equatorial plane. So the insertion of the recti muscles is onto the sclera in front of the equator, just behind the sclerocorneal junction, just behind the sclerocorneal junction. So they are inserted in front of the equator of the eyeball and behind the sclerocorneal junction in the spiral manner all around the sclerocorneal junction. So this is the diagrammatic view where we can visualize the recti muscles as I have just now mentioned. The superior rectus along the upper part, the inferior rectus beneath along the floor of the orbit. We can also make out, visualize the orbit and the attachment of the recti muscles onto the sclera over here. This is the diagram showing the anterior view of the eyeball, where we can make out the insertion of all the recti muscles. The insertion of the recti muscles, that is the superior, middle, inferior and the lateral recti, are inserted just behind the sclerocorneal junction, the junction between the sclera and the cornea. So the insertion is about few behind the sclerocorneal junction, that is the medial rectus is closest to the sclerocorneal junction. So the medial rectus is attached about 5 behind the sclerocorneal junction. Then next comes the inferior rectus. The inferior rectus is inserted about 6 behind the sclerocorneal junction. The lateral rectus is attached about 7 behind the sclerocorneal junction, whereas the superior rectus muscle is inserted about 8 behind the sclerocorneal junction. So this is about the insertion of all the recti muscle onto the sclera just behind the sclerocorneal junction. So the nearest muscle to the junction is the medial rectus, whereas the superior rectus is the farthest muscle from the sclerocorneal junction. So from the sclerocorneal junction, the medial rectus is about 5 behind. Then next comes the inferior rectus, which is about 6 Then comes the lateral rectus, where the insertion of the lateral rectus is about 7 behind the junction, and the superior rectus muscle is attached about 8 behind the sclerocorneal junction. So the attachment is in a spiral manner from medial to lateral. So this is about the insertion of the recti muscles. Moving on to the oblique muscles of the eyeball. As I have told, there are two oblique muscle. Out of the two oblique muscle, one is the superior oblique and second is the inferior oblique muscle. When we talk about the origin of the superior oblique muscle, the superior oblique muscle is seen to get arising from the undersurface of the lesser wing of the sphenoid bone. So the origin of the superior oblique muscle, as we can see here, this superior oblique muscle is seen to arise from the undersurface of the lesser wing of the sphenoid. The origin of the superior oblique, this is the superior oblique which is seen here. The superior oblique is seen to arise from the undersurface of the lesser wing of the sphenoid and medial to the common tendinous ring. So this is about the origin of the superior oblique muscle. This muscle is directed forward and it is seen to lie between the roof and the medial wall of the orbit. I repeat, so the muscle is directed forward, where it is seen to lie between the roof and the medial wall of the orbit. And this muscle is a bit special here, as it forms a rounded tendon here, which we can observe. It forms a rounded tendon which passes through the pulley. It passes through the fibrocartilaginous pulley, and it is seen to get inserted onto the eyeball behind the equator. So the oblique muscle is seen to get inserted into the sclera behind the equator, whereas the recti muscle are inserted in front of the equator. So this oblique muscle, once it runs along the pulley, it is directed backwards to reach the posterior superior part of the eyeball, and it gets inserted over the posterior superior part of the eyeball behind the equator. So this is about the muscle superior oblique. When we talk about the inferior oblique muscle, when we tend to know about the muscle inferior oblique, the muscle inferior oblique is seen to arise from the orbital surface of the maxilla. So the origin of this muscle is over the orbital surface of the maxilla over here, and the insertion of this muscle is again onto the sclera behind the equator. That is, the muscle passes at first backwards and laterally below the inferior rectus. As we can see the relation of the inferior oblique and the inferior rectus over here. This muscle, the inferior oblique, tends to run below the inferior rectus and it is directed upwards, backwards to reach the sclera behind the equator, and it ends by inserting into the posterior superior quadrant of the eyeball. So both the oblique, that is the superior oblique and the inferior oblique, the two oblique muscles, they get inserted onto the posterior superior quadrant of the eyeball behind the sclerocorneal junction. So this is about the attachments of all the muscles, that is all the extrinsic muscles of the eyeball. This is the diagrammatic view, very easily explaining the attachments of the muscles, extraocular muscles. As we can see here in this diagram, we can just make out the green ring represents the common tendinous ring over here. This common tendinous ring, as I have told, receives the attachment, gives origin to all the recti muscles. That is, from the medial side there is medial rectus, we can make out the lateral rectus as well as the superior and the inferior rectus, all of which are seen to take its origin from the common tendinous ring from the respective sides. We can also look on to the attachment of the oblique muscle, that is superior oblique, which is seen to take its origin from the undersurface of the lesser wing of the sphenoid and also medial to the common tendinous ring. This superior oblique muscle is directed forward between the roof and the medial wall of the orbit, passes through the fibrocartilaginous pulley, and it is directed backwards and laterally to get inserted onto the equator, onto the sclera behind the equator. So this is the anterior view where we can make out the insertion of all the four recti just behind the sclerocorneal junction, a few behind the sclerocorneal junction, the nearest of which is the medial rectus. This we can also make out the superior oblique passing through the pulley over here. Again, this is the posterior view of the eyeball where we can make out the insertion of mainly the oblique muscles visualized here. The insertion of the oblique muscle, as I have told, the oblique muscle tend to get inserted over the sclera behind the equator, behind the equatorial plane. So this is the insertion of the oblique muscle along the posterior superior quadrant of the eyeball. We can also make out the attachment or the insertion of the four recti muscle in front of the equator in this view. So this is about the diagram representing the attachments of all the recti and the oblique. We can also see here the inferior oblique. It's not related to the tendinous ring, as the origin of this inferior oblique is from the orbital surface of the maxilla, as I have told. This is the superior view where the levator palpebrae superioris is been separated, and we can also make out the cut muscle of the superior rectus to visualize the optic nerve as well as the inferior rectus, which is seen beneath here, beneath the eyeball. We can visualize the medial rectus, we can make out the lateral rectus over here. We can also make out how beautifully the arrangement of the superior oblique is appreciated. As I have told, the superior oblique, which is seen to arise from the undersurface of the lesser wing, which is seen medial to the common tendinous ring, which is appreciated over here. We can also make out the winding of this superior oblique tendon within the pulley, fibrous pulley, which is seen to get attached over the frontal bone here. The insertion of the superior oblique where the tendon is directed backwards and laterally to reach the sclera behind the equator. This is again the atlas view where we can make out the upper view showing the anterior view where we can visualize the attachments or the insertions of the recti muscle just behind the sclerocorneal junction, as I have already mentioned, we can make out the two oblique muscles as well, the superior as well as the inferior oblique also. This is a section, the coronal section, showing all the recti and the oblique muscle. Just observe the location of the superior oblique as well as the inferior oblique. As we can see, the superior oblique is seen to locate medial to the superior rectus and above the medial rectus. We can also make out the location of the inferior oblique, which is seen to lie beneath the inferior rectus muscle in this view. Next, moving on to the nerve supply of all these muscles, the entire extraocular muscles are supplied by the two divisions of the oculomotor nerve, which is the third cranial nerve, the section representing the nervous supply of the oculomotor nerve to all the recti and the oblique muscle through its branches, that is through its two divisions, except, yes, there is an exception, all the muscles are supplied by the oculomotor nerve. All the muscles are supplied by the oculomotor nerve except the muscle lateral rectus, which is supplied by the abducent nerve, and also the superior oblique, which receives its nerve supply from the trochlear nerve. So we can see the superior oblique receiving the nerve supply from the fourth cranial nerve, that is the trochlear nerve, and also the lateral rectus muscle, which is receiving the nerve supply from the sixth cranial nerve, that is the abducent nerve. So this is the exception. So all the muscles of the eye, that is the extrinsic muscles, are supplied by the oculomotor nerve, which is the third cranial nerve, except superior oblique, which is supplied by the fourth, and lateral rectus, which is supplied by the sixth cranial nerve. So SO4 LR6, this is what needs to be remembered. So this is about the nerve supply of the extraocular muscles seen here. This is again the section showing the superior view, the diagrammatic view, where we can make out the superior division of the oculomotor nerve supplying the muscle, the superior rectus, as well as the levator palpebrae superior muscle. This is the deeper dissected diagrammatic view, where we can make out the muscular supply of the inferior division of the oculomotor nerve supplying the medial rectus along with the inferior oblique and the inferior rectus over here. Here we can make out the supply, the trochlear nerve tend to supply the superior oblique muscle over here. This is the atlas view, the superior atlas view, showing the relation of the nerves with that of the extraocular muscles. As we can see, the trochlear nerve located here, the trochlear nerve, which is seen to reach the muscle superior oblique, the trochlear nerve, which is seen to reach the superior oblique here. The deeper dissected view, where the ganglion, ciliary ganglion, is appreciated, as well as we can also make out the inferior. So in the deeper dissected view, we can make out the supply, nervous supply of this inferior division of the oculomotor nerve to the inferior recti and the inferior oblique muscles. Next, moving on to the arterial supply of the eyeball. So the orbit as such, it is supplied by the artery, that is the ophthalmic artery, which is the branch of the internal carotid artery. The entire orbit is supplied by the ophthalmic artery here, which is seen to arise from the internal carotid artery. This ophthalmic artery enters the orbit by passing through the optic canal, and we can make out the branches of this ophthalmic artery like that of the ciliary branches, the ciliary arteries, the ethmoidal arteries, the central artery of retina, all of which they again branch to supply the contents of the orbit over here. So we can make out the dissected view, where we can make out the ophthalmic artery, which is seen to arise from the internal carotid reaching the orbit and supplying the entire content, which are seen clearly here. Next, moving on to the venous drainage of the orbit. The two veins which are involved in the venous drainage are the superior ophthalmic vein and the inferior ophthalmic vein. This superior ophthalmic vein drains the orbit and it is later seen to drain into the cavernous sinus. The vein reaches the cavernous sinus by passing through the superior orbital fissure, whereas the inferior ophthalmic vein drains the lower portion of the orbit. That is, this vein collects blood from the inferior orbital muscles, the lacrimal sac and the lower eyelids, and it is seen to pass through the superior orbital fissure to join the pterygoid venous plexus. So the inferior ophthalmic vein is seen to join the pterygoid venous plexus. So it communicates with the pterygoid venous plexus through the inferior orbital fissure as seen here. So this is the atlas view where we can make out the superior ophthalmic vein tend to drain into the cavernous sinus as seen over here, and we can make out the pterygoid venous plexus where the inferior orbital vein, orbital vein ends by draining into this venous plexus as seen here. So this is about the venous drainage. The superior ophthalmic vein is devoid of valves here. Next, so this is the view showing the first layer of the orbit visualized immediately after separating the orbital plate of the frontal bone. As we can see mainly the periorbital pad of fat, and once this pad of fat, orbital fat, is separated, we can make out the levator palpebrae superioris muscle, which is related to the superior ophthalmic vein as well as the nerve, that is the frontal nerve, along its superficial plane. So even in the very immediate portion, once we separate out the periorbital fat and the bony part, what we see is the LPS muscle along with the frontal nerve and the superior ophthalmic vein, and on either side we could also make out the superior oblique muscle. Once we separate the levator palpebrae superioris muscle in the third layer of the orbit from its superior view, what we see is the superior rectus, which is seen to lie immediately beneath the levator palpebrae superioris muscle. We could also appreciate the superior rectus and superior oblique seen here. Once this superior rectus is reflected and the complete pad of fat is separated, we can make out the round ball of the eyeball, and the attachment of the superior oblique is well appreciated once this is exposed. That is, once the superior oblique and the superior rectus is been exposed here, which is visualized in a better view. In the deeper section, viewed from the superior side, when in this picture we can make out, in this atlas view, the optic nerve is been separated to visualize the muscle present beneath it, that is the inferior rectus. We could also appreciate in the deepest plane, after separating the entire eyeball, we can make out the branch, that is the divisions of the oculomotor nerve, the branches of the inferior division of the oculomotor nerve as well as the superior division, which has been separated here, supplying its respective muscles. So this is the section representing the contents of the orbit and its distribution along with its nerve and the vessels layer by layer. So this was the end of the discussion about the extraocular muscles, its attachments, and also the nerve supply along with the blood supply. Moving on to the actions of all these extrinsic muscles of the orbit, as the name itself says, all the muscles bring about the respective action, like that of the superior rectus bring about the elevation of the eyeball, the inferior rectus bring about the depression, the medial rectus is involved in the adduction, whereas the lateral rectus brings about the abduction. One thing which needs to be remembered is all the recti are the adductors of the eyeball. So the recti are the adductors of the eyeball, whereas the obliques are the abductors obliques are the abductors. So this is what is needed to be remembered. The recti are the adductors. So adduction action of the extraocular muscles is brought about by the recti muscle, whereas the abduction action is brought about by the oblique. It is brought about by the oblique muscle. So this is about the adduction and the abduction. And the other thing, which is other statements which is required to be remembered, is that all the superiors, the superiors are the intorters of the eyeball. The intorsion is brought about by the superiors, that is the superior rectus and the superior oblique, whereas the inferiors, that is the inferior rectus and the inferior oblique, bring about the extortion of the eyeball. So this is about the actions of the superior and the inferiors. So for example, when we talk about the action of the muscle, the superior rectus. So superior rectus brings about the elevation of the eyeball. Along with the elevation, because it is a superior muscle, it brings about the intorsion, and because it is the oblique, because it is the recti muscle, as I have told, recti are adductors. So this superior rectus is involved in the adduction of the eyeball as well as. So in the same way, the inferior oblique, when we look for the inferior oblique, because it is an oblique muscle, the oblique, it is brings about the abduction of the eyeball. It brings about the extorsion of the eyeball. So this is about the action of the inferior oblique. So this is about the regarding the actions of all the muscles, that is the extrinsic muscles. So in this video we have studied about the extrinsic muscles of the eyeball along with its attachments, the relations, the nerve supply, the blood supply, along with the actions of these muscles. Thank you.